Hello, my name is Amy Sturkey. I am a pediatric physical therapist. Oh gosh, and I'm with Myla, who is 7 years old, and Maycie, who is 10 years old. And we're working on oral motor, sensory motor awareness. So children who are low tone, such as Myla, or have Down syndrome, they tend to be not so aware of their oral structures. They don't know where things are in their mouth, and that makes it harder for them to copy movements. So one of the thoughts is you increase the sensory awareness in their mouth, and then they can do better at being able to copy sounds. So what I have here is the super duper jumbo mighty mouth, which is very, useful for demonstrating things. So on this one, on a previous video, we did just simply the lips, but this time I'm gonna go really into the mouth. So on this one, I'm going to go a multi-step thing. On the first one, I go between the gum line and the lips on the top, and I do that 3 times. Between the gum line and the lips on the other side. Top, 3 times each, 1 on the bottom, and then I do the same thing on the inside. This is where often you have to give them a break in between because it feels quite intense. Between the gum line and the ridge of the mouth, 1, 2, 3. Gum and the roof of the mouth, 1, 2, 3. Gum and between the teeth and the tongue. Gum and between the teeth and the tongue. Okay, Maycie. Oh, 2 more. Across the tongue, 1, 2, 3, and across the top of the palate, so perfect. 1, 2, 3. Okay, the one that I'm using here is an ARCS probe. This one is a Nook in UK. They each have sort of different profiles and how much sensory input they give to the mouth. The one I have for Myla is not as intense. The one for Maycie is significantly more intense. Hi. So if at any point you need me go, wait a second, I gotta get my mouth back together, let me know, okay? All right, so I'm gonna do first the one on the outside top. Ready? 1, 2, 3. On the outside top, ready? Let me in there. 1, 2, 3. Outside bottom, you ready? 1, 2, 3. Outside bottom over here. 1, 2, 3. Okay, across the inside. You ready? Inside top. 1, 2, 3. Woo. On the other side. 1, 2, 3. Bottom. 1, 2, 3. On the other side. 1, 2, 3. And I'm going on top of your tongue. You ready? 1, 2, 3. And on the roof of your mouth, this is the one that gets me. 1, 2, 3. Very nicely done. You can hold that. Myla! You ready? Okay. Going to the top outside. 1, 2, 3. Beautiful, Myla. Top outside on top. 1, 2, 3. Beautiful, Myla. Bottom outside. 1, 2, 3. Myla, you're doing so good. Bottom outside. 1, 2, 3. That is so good. Going for the inside. You ready? Inside top. 1, 2, 3. Wow, you're so good. Top inside. 1, 2, 3. Wow. Bottom inside. 1, 2, 3. Sometimes I really have to struggle. The tongue will sometimes really fight me. Oh, you're pulling your tongue back. 2, 3. So nice. Now I'm going to get the top of your tongue. Ready? 1, 2, 3. Now the top of your mouth. Ready? I got to get in. 1, 2, 3. I got to take it out. Myla was amazing at this. Maybe I have sensitive oral structures, but when I do this myself to demonstrate, I'm like, woo! Anyway, This is a great way to increase the sensory awareness of the mouth. For my children who are really sensory averse or really are not good at articulation, I recommend families do this 1 to 2 times a day to see over a week or 2 of time if they have a little bit more oral awareness and are more able to articulate words better. I find this activity really helpful, not only for my low-tone children, but also for children who are on the autistic spectrum who are nonverbal. I hope this is helpful for you, and we'll look forward to seeing you next time. Thanks a lot. Bye-bye.
If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.